Hi, I'm Dr. Nitish Jhavar, laparoscopic colorectal surgeon from Apollo Hospitals, Navi Mumbai. In this video, I'm going to talk to you about the advanced treatment of the hemorrhoidal disease, or commonly known as piles. Now, when you have symptoms of some bleeding coming from the rectum, if there is any bulge which is coming out when you're passing stool, or if there is irritation or some mucoid discharge from the anal area, usually these are the symptoms of the hemorrhoids. Now, it's important that you visit a specialist to figure out what grade of hemorrhoid you have, because all your treatment plan will depend on the grade of hemorrhoid which you have. So, if you have hemorrhoids which are only causing bleeding, they are usually grade 1. Once they start coming out, then depending on the prolapse, whether they come out and they go back on their own again, or you need to push it inside, or they remain outside all the time, will decide the grade of the hemorrhoid. Now, what are the treatment options? So, once you go to a specialist, after the examination, depending on the grades, we have certain minimally invasive ways of treating. And these are the treatment plans which can give you a very comfortable recovery afterwards. So, the usual fear in people's mind that, it will be very painful, it will cause bleeding, and all those things are not there. So, out of the options which are available now, we have treatments like DGHAL. We call it Doppler guided hemorrhoidal arterial ligation, which can be done by just ligating the feeding vessels to the hemorrhoid. It can be done as a OPD procedure, and it's quite painless. There is no excision or cutting of the tissue, so there is no wound as such which will cause bleeding or pain later on, and recovery is much faster. Now, the only thing is that if you go early in the course of the disease, then only this treatment can be offered to you. So, for a grade 2 hemorrhoids, DGHL is a wonderful treatment. Other option which has come recently is the laser hemorrhoidoplasty. We call it LHP, or there is a HELP procedure, which is hemorrhoidal treatment using a laser probe. Now, both of these can be done in OPD basis, daycare basis, or one night stay, and this particular technique requires burning of the tissue which is forming the hemorrhoidal mass, and it shrinks almost immediately, and within 2 to 3 weeks the whole thing disappears. Now, if you look at laser and DGHL treatment, they are the most recent treatments which are available for hemorrhoidal disease, and as I emphasized again, that this can be a painless, bloodless treatment which can give you a very early recovery. So, if you have any of the symptoms which I mentioned, you can get in touch with Apollo Hospitals in Navi Mumbai and then come for a examination, and then we can guide you further in this regard. Thank you very much.